The Aspen Vista CTO supports the cervical and upper thoracic spine from C1 to T2 dependent on patient condition. The CTO2 and CTO4 are both fully adjustable to fit the vast majority of patients' anatomy. The CTO provides safe and effective motion restriction for patients in need for an extended wear product. The innovative design allows the product to be fully adjusted. The addition of the multi-post back panel allows extra support and adjustability around C1 with the occipital support as shown. These supports can be adjusted and then locked with the yellow switch. The Aspen Vista CTO comes in two options: the 2-post without posterior strut, CTO2, and a 4-post CTO4, as shown in the images. The component parts of the CTO are as follows: front, chin pad, access window, adjustment dial, yoke adjustment button, yellow height adjustment button, back panel clips, and then the back. Occipital pads, posterior strut, adjustable straps, lower adjustment, and base of back pad. Check the product is in full working order by testing all the adjustment points as shown. The application of a 2-post or 4-post CTO will have been determined by your clinical team. The different types are CTO2 and CTO4. The first step in fitting a 2-post CTO is to position the multi-post back panel. One person is to stand at the head end of the bed, performing a head hold to maintain a neutral alignment of the cervical spine until the collar has been fully fitted. The second person positions the back panel next to the patient's head between the patient's earlobes and trapezius muscle upper shoulder. The Velcro straps should read Aspen Vista the right way up to the person fitting the collar. Place your hand on the back panel and simultaneously press down to compress the bedding. Slide the back panel behind the patient's neck until the back panel is positioned correctly. The back panel should be centered behind the patient's neck, and the Velcro strap should be pulled out to the sides and aligned at midpoint between the patient's earlobe and the top of the trapezius muscle. The patient should be encouraged not to move their head and to lie still. To apply the back panel, position the panel next to the patient in line with the lumbar spine, ensuring the panel is the correct way round with the opening for the posterior strut facing the top as shown. Pads facing upwards, slide the panel under the patient and then move to the opposite side and pull out the straps. Feel for the bottom of the rib cage and line up straps with the bottom of the rib cage. If fitting a CTO4, a 4-person log roll should be performed. Line up the back of the collar so the straps are mid-neckline and then assess if the posterior strut will need to be adjusted in length so that the lumbar back panel aligns with the lumbar spine. Once the sizing has been adjusted, slide the lumbar back panel under the patient and position so that the posterior strut aligns centrally, checking all pads are in place. Log roll the patient back onto the brace. Take the front section and pre-form the collar. Slide this under the patient's chin with the sternal notch visible within the access window. Dial the collar up by pulling out the dial and turning clockwise until the foam pad on the chin piece starts to compress. The dial will automatically self-lock upon releasing. To ensure the dial is locked, twist the dial without pulling to ensure it is in the locked position. Check the patient can breathe and swallow. The collar should be tightened by tucking the side panel around the neck and pulling the Velcro tabs forwards. Repeat on both sides. The pitch of the front panel can be changed to suit the patient's anatomy. Push and spread the grey yoke button and allow this to drop onto the patient. Then click the yoke back together. The length of the front panel can be adjusted by pulling the yellow button down and then pulling on the lower section and positioning on the lower rib. Take the clip and place it back into position until the click repeats on both sides. Pull the straps tight so the brace is snug and tuck the straps in or trim to size. Check both Velcro straps are aligned symmetrically. The collar should be flush with the skin and there should be no gaps in the collar. To check this, push your finger down past the ear, behind the mandible, and run your finger along the collar towards the chin and then underneath the sternal aspect of the collar. Check the back of the chin piece is not pressing into the patient's throat and that they can breathe and swallow. Run your finger around the lower section of the brace and ensure the pads are flush with the skin and all pads overlap plastic components. To add the posterior strut to a CTO2, perform a 4-person log roll. The strut will align and fit into the 3 slots shown. Align the strut and pull down until this clicks and is locked in place. Place the lower section of the strut into the slot at the bottom. Use your alternative hand to guide the piece in from behind the brace. Ensure this is locked in place. The posterior strut can be shaped and adjusted as shown in the video to suit the patient's anatomy. To do this, we bend and adjust the bar on the edge of a table or hard surface. Run your finger around the occipital pads and ensure they are flush to the skin. Check that all foam is overlapping plastic and that the brace is firmly applied. Perform a 4-person log roll and ensure the patient is secure. Push in the button at the top of the strut and push up until it's released. Repeat this at the bottom and pull out the strut from the lumbar panel. Log roll the patient back. To fit the posterior strut in sitting, ensure the strut is adjusted to the correct height and line up the upper section into the slots as shown. Once this is secured, slide the bottom section into the slit and push the bar down until the button clips securely in place. Check all the foam is overlapping the metal and plastic components. Press and unclip the two front straps and spread the yoke and flip the front section up and start compressions. Alternatively, you can unclip and remove the front section with the two front clips at the bottom of the collar. There are pads for the front panel, chin piece and back panel. The Vista pads can be removed when soiled and changed for a new clean set. To replace and adjust the pads, the grey-green colour material grips the Velcro dots. The pads must cover all edges of the plastic to avoid touching skin. To remove the pads from the front panel of the collar, lift off from the Velcro tabs. To reattach the pads on the front of the collar, properly align the bottom larger pad with the corresponding Velcro dots and the plastic circle component of the collar. For the upper pad, ensure that the top piece covers the front and rear edges of the plastic components and is attached to the Velcro dot on the chin piece. To remove the pad on the back panel, unthread the straps on each side, then pull the pad off the back panel. To replace the back pad, begin attaching the grey-green side of the pad to the Velcro dots on the back panel. Once the padding is aligned with the plastic, the straps will need to be rethreaded through the padding and plastic slots. The plastic components can be cleaned with either mild soap and water or a disinfectant wipe. Ensure it's dry before the pads are reattached. The pads can be hand washed in mild soapy water and left flat to air dry. Remove the collar at least once per shift. A head hold should be performed on patients that are bedbound with unstable cervical spine injury. Keep the skin clean, dry and cool. Remove the collar. Inspect the skin at least once per shift, particularly at the bony prominences. The usual pressure points are chin, collarbone, throat, sternum, earlobes and the back of the head. Check for signs of skin breakdown and palpate for skin changes, including within the hairline. Maintain hygiene under the collar. Clean the skin under the collar daily. Wash with warm soapy water and dry thoroughly. Do not apply powder or lotions. Change the pads if they become wet or soiled. Make sure long hair is moved out of the way and that there is no jewellery, other objects or debris in between the patient's skin and the collar. If you have any concerns regarding the fit of the collar, please escalate to your local specialist team for review and appropriate management.